Hello, everyone. Welcome to the Harvard Global Health Initiative coffee session. Can AI transform global health? Promise, progress, and reality. I'm the moderator, Matthew Bonds, Associate Professor of Global Health and Social Medicine. This session examines the state of AI in global health through the central question, how do we ensure that the evidence base and frontline capacity keep pace with the speed of deployment? Where does hype outpace the evidence? The session will explore persistent gaps in health systems, from workforce shortages and delayed diagnostics to fragmented data systems, alongside the growing landscape of the AI applications intended to address them. The session is co-hosted by the Center for Bioethics at Harvard Medical School. So we will begin with some discussion with our guest panelists, Mr. Sameer Pujari and Dr. Rose Nakasi, and we'll end with live Q&A from the audience. So, Mr. Samia, oh, great. Allow me to introduce the two panelists first, and then we'll just jump into the discussion. Mr. Sameer Pujari leads the WHO's AI for Health program and serves as the head of the WHO Secretariat for the Global Initiative on AI for Health. He previously led the development and negotiation of the WHO Global Strategy on Digital Health across all 194 member states. And most recently, he played a leading role in developing the casebook on the real-world impact of AI in health, which will be hopefully really helpful for this discussion. Dr. Rose Nakasi is a lecturer at Makerere University and head of the Makerere AI Health Lab in Uganda. She holds a PhD in computer science, and her research focuses on application of AI to address real-world healthcare challenges. She serves on Uganda's National AI Task Force and chairs the topic group on AI-based detection of malaria at the WHO Global Initiative on AI for Health. Both of them spanning research and real-world applications. So let's get started. So I'll start with presenting some general framing questions for both of you, and I'll ask Sameer to first respond, and then we'll get into more direct questions. So when we talk of AI transforming global health, it can feel abstract. So let's start from the real world, from the perspective of patients and frontline workers, often in distressed health systems. What are the real problems that urgently need solving, and is AI actually helping to solve them yet?
Thanks, man. That's a great question to start off. I mean, I think, and this is something that we're grappling on a daily basis with WHO and our member states, right? I mean, the first thing is, what are the real problems? There are pain points in the health system. And let me maybe anecdotally state what I feel. We often say in public health that disease is the biggest killer. I think it's delay which is the biggest killer actually in today's world. And delay because we cannot get the health services to the population, to the people that need it. Delay because there are very limited healthcare providers who can do that. I think that's where we see the potential of AI creating that opportunity for delivery of care in the pain points in the health systems. And we'll see a lot of examples that came out. But I mean, there are various domains that we're looking at. I'll give some examples in the biggest killers in different domains, whether it's the typical maternal child health systems where there is ongoing. I mean, every time there's a post-maternal hemorrhage situation, the hospitals ransacked. In high-income countries, you have a big team that starts working towards that. But that doesn't happen in low-income countries. I mean, when there's a postpartum hemorrhage, we are still losing women and mothers because of those complications, because you cannot do that. Now, AI has the potential to predict these cases. Going to diabetes, there are no health systems to detect and help diabetes. We're seeing in Thailand, I was reading a case study very specific on Thailand, where there are 200 odd retina specialists for 500,000 people who are suffering with diabetes. There is no mathematical formula that says that we can solve that problem. We have a gap of 10 million healthcare providers that cannot be addressed. And so AI has the potential to bridge in those problems. And so there are clear-cut health systems pain points where we have a potential that AI can come in and help blend in, solve some of those address and issues in sort of complicating things. But of course, so I'm an optimist, an eternal optimist in that space and having studied the science. But I have a very strong anecdote that goes with it. We cannot be an optimist. It has to be a cautious optimist approach. as WHO, and our that's what we've been doing over the past few years, is trying to see where these pain points can be addressed, whether it's gap in the healthcare services, whether it's trying to address those vision situations where we don't have radiologists to screen cervical cancer, or we don't have radio specialists to retinal specialists to diagnose diabetes. So I think that's where I see the real problems exist and a potential that AI can help solve those.
Okay, before we move on to Rose, can I just ask a couple follow-up clarifying questions? So you're talking about big problems in workforce shortage and times and delay, and you see the potential of AI applications in addressing them. Are we talking potential here? Are we still talking about where, looking into a few years into the future, where do you see these applications being developed, kind of applied now well, or where are we not quite there? Or where do you see us in that process?
We're not quite there. I mean, clearly we're not there in terms of scalability. That's what we are seeing. And we risk ourselves um, being stuck. I mean, this is not something new that we've seen. We've seen this in digital health space. We've seen this in the e-health space, where we had pilotitis. Pilots kept on going in. Labs were amazing. There were great results. Publications came out, and it was not put to scale. And the gap was from the sentence that whether AI works versus whether AI works here. And when I say here, that's what we ask the questions is you cannot just take a blanket approval and say, okay, take this lab tested, a beautiful clinical study we've tested, and let's deploy it everywhere. It has to be localized. And when I say localized, the key part is it sits in a governance system. You cannot bring, and we've seen this in COVID times as well. We had technology solutions that could do contact tracing, but the regulations were not there ready for deployment. So it's about having that ecosystem prepared for AI to be deployed. And I think that's where I'm saying we have massive risk. And there are several factors, one specifically being rethinking investments. And I've been saying this again and again. If the governments, if the health systems are not rethinking the investments of how AI needs to be deployed, we will still be stuck with amazing opportunities. A solution this time that can actually help solve these problems. We have seen science around it, but without a systems change, a systems approach, and a localization centered approach, we're going to fail that. So I think that's a very important part that we need to work on with member states and stakeholders.
Thanks. Dr. Rose, should I re-ask the question or do you remember it? Can you share your response?
Yes, thank you very much. And this is a very interesting conversation and sits at the core of, especially where I'm seated at right now in Uganda, one of the low and middle income countries. Expert has already put that straight. We look at scenarios and the perspectives of the work that we bring at the what are the contextual limitations, especially in the healthcare systems? We've had a very big challenge of these diseases, especially when you look at malaria, when you look at diseases like cervical cancer, when you look at diseases like tuberculosis. The major limitations that we are sitting at right now in our context is the lack of the expertise. So in terms of the expertise, it sometimes does not necessarily mean that we actually lack, patients lack where to go for these services, because we have healthcare services, we have health hospitals around. But the bigger question that we are grappling with is, can we be able to have a timely diagnosis of these diseases? And at core of diagnosis sits the critical need of expertise, which is a critical challenge that we're having in most of these contexts. So from our perspective, and whatever we're doing is actually at the concerns of delayed diagnosis, the shortages of trained experts, the uneven quality of care, fragmented data systems whereby you have situations whereby one facility is not talking to another facility, and when it gets into the country level interventions, there is no way that they can get, quality information, because all these are fragmented across the different healthcare units, but also the healthcare workers are operating under overwhelming workload pressure. So looking at all these, limitations and challenges that we're facing, especially in the healthcare sector, we're looking at how can we then utilize artificial intelligence to transform health even at contextual levels. And when you talk about how do you want to think about artificial intelligence, for example, for the work that we are doing under Ocula, whereby you're looking at a solution that is not just contextual, but also goes back to the economics of the country. You're looking at, can it be cost effective? Can it be practical? Can it be even integrated? Because sometimes you're not looking at the very complex AI tools that we're thinking about, especially in the global north, but we're looking at that tool that can be able to integrate within the already existing health infrastructure so that we can leverage the impacts and the benefits that come with that. And so sometimes we need to think about what are the necessities, what are the requirements that are needed for us to look at and seize that potential that is provided by artificial intelligence. So if I can give a solution of Ocula, for example, we are looking at a solution that is going to support the few experts that are sometimes in our healthcare systems. For example, if I can give statistically in Uganda, we have not more than 30 pathologists to be able to service this so many cancer patients across the country. But also when we go to other diseases like tuberculosis, malaria, which are some of the high burden disease challenges in our context, still you see the same statistics cutting across all those. So Ocula comes in to provide that solution where we have very few expertise, leveraging the already existing microscopy diagnosis system, which is the gold standard, and it's also available in some of these healthcare services. We also want to think about solutions that are going to, be contextual in a way that if you don't have internet connectivity, for example, in one village A, where malaria is very prevalent, can we have artificial intelligence reach those environments, sometimes which are hard to reach, but also in terms of infrastructure, there is a limitation. So we want to think about offline fast systems that are able to, be contextualized. And those are some of the thought-provoking intuitions that we put in some of the work that we're doing to provide solutions that are contextual, that are impactful, especially in situations that are not, very well developed. Thank you very much.
Before we move it back over, can I just, follow up on this and would you just walk us through a little bit with a little more specificity on the technologies that you're describing, help listeners understand exactly what the problem is? You talked about malaria diagnosis and in remote areas without connectivity, et cetera, but maybe you've actually covered a lot of ground, but I think going from understanding the exact illness that we're talking about, and just walk us through the little more detail of sort of what the technology is and maybe how it's deployed.
All right. So I'll talk about Ocula. It's an AI-assisted microscopy diagnosis tool for diseases such as malaria. So how it works is that one, we're leveraging the gold standard, which is by the use of the microscope. So we have a microscope at almost every public health facility. We're also leveraging tools or equipment such as the smartphone. And what we have done is that we have developed a 3D printable adapter that provides an attachment of the smartphone onto the eyepiece of the microscope. What this literally does is that it takes away the strain that the expert on the other end who is seated to look into the microscope to look out for these pathogens in the blood sample is able to sit at the comfort of their chairs through the screen of the smartphone to be able to visualize, whatever is under the microscope. We have coupled that now with artificial intelligence that is able to map out any objects of interest. And in this, I mean objects such as the malaria parasite, any malignancy in a cancer slide, tuberculosis bacilli. And we have been collaboratively working with different healthy facilities in Uganda to be able to support us on understanding, first of all, the morphology of these parasites. And using artificial intelligence, we are now have come up with robust artificial intelligence models that can assist in the detection of these diseases.
Okay, so let me, sorry to interrupt, but I just want to make sure I'm following you. Is this a technology that is has been adopted and deployed, and or are you in the research phase? And just like to put a finer point on it, are you talking about these technologies that are at working at hospitals, or are you talking about deploying these at primary care centers? Everyone with a microscope, in theory, could be using this. Could you help me understand a little bit? You put in a blood sample, you look at it through the microscope, attach an iPhone, and then have some diagnosis. Is that help us understand where you are in this development process,
So in
please?
the development process right now, we are piloting the tool in over 20 healthy facilities, including the national referral and district hospitals, up to the lower facilities of healthy center force. And what we are trying to do is to gain evidence out of the tool to check its impact before we do the massive scale out across the entire country and different countries. I think the impact that we want to think about with this tool is one of the things that I explained earlier, but just to re-echo the impact and why we think this is very helpful. We are leveraging already existing equipment in the different healthy facilities, and that is one of the key considerations as we try to develop these tools. And the other thing is where we have expertise, can this be an augmentation decision support tool that is going to support, especially the few expertise that we have on ground to support the accurate diagnosis of these diseases? So we're seeing this from where we sit. The question is whether AI has potential, and we're already seeing that in areas such as where Ocula is trying to disrupt the way diseases are diagnosed. And the bigger question, whether we can actually responsibly be able to integrate these tools into the real life healthcare systems in ways that are very sustainable, evidence-based, but also genuinely useful, especially to the frontline workers and to the entire patient community at large.
Thank you. This is excellent. Sameer, I have the same question for you. You worked on this casebook on real world impact of AI in health, and in that there are a number of examples of use cases. What are the best ones that you would cite of applications of AI that have had real impact?
Thanks, Matt. Yeah, I think the objective was what you said, right? Are they in research? So we wanted to actually see which ones have actually left the lab, and that was the intention of this case book, where we want to see which ones are out there and performing and sharing. So we grouped we had about 350 odd submissions, but what we did was we grouped them into 6 major categories. The first one was vision. We're using computer vision and look at AI and how its diagnosis working on. And that's where we saw a lot of success. So vision included diabetic retinopathy, DR. There was great examples of scalable. And this is, as I said, a potential which is ready from a technology perspective, but not from a governance perspective. Something that can be scaled up where the health systems gaps, and we can see that replicate. Another example, cervical cancer screening. Like malaria microscopic, you can now, things that costed over hundreds of dollars to screen a rural African female for cervical cancer diagnostics, going to the lab, getting all the pap smears and everything. Now you can have the healthcare worker take the AI loaded camera on her phone and scan and sort of do the first triaging at the point of care itself, whether it's a primary healthcare center or the household of the patient. And that's amazing, and bring the cost down to a few dollars. I mean, that's what we're seeing. These are some potential examples that can scale up. Another big one we saw was these predictive models. So I said vision was one of them. Then predictive models and decision support tools are 2 other areas which have seen a lot of strength. Decision support in terms of helping triage patients. I mean, we're seeing the heavy burden. I mentioned a gap of healthcare providers. The heavy burden that we are seeing in All India Institute of Medical Sciences, for example, was one of the case studies where 2 million outpatient, 200,000 outpatient patients coming out every week. And it was difficult to triage them. They're using these AI tools to help them triage, which have simple decision support tools, enabling better healthcare service, just access to medicine and sort of healthcare, which was not there. China has deployed this at scale now. I mean, they have these initial triage machines at scale. That's amazing sort of case studies that are not being replicated as much they should be and being invested into, as I said again. They're being vertically done. The other big area that we are seeing is predictive models. As I said, for we have data sets from maternal child health, from pregnancy cases, there are models that have shown that they can predict not just outbreaks. I mean, that's a big thing, but even at the hospital post pregnancy hemorrhage, and save lives of women in lower income settings. I think that's where the model sees. And there were three other domains. So we have seen vision, decision support tools, and predictive models as the most advanced ones. But the more potential ones are ambient AI with sensors helping uh, take care of documentation of the care provision for the patient. So the doctors can see more patients rather than documenting the processes. There's robotics, which is coming in, and simple, again, triaging the systems of robotics for access to medicine. And then last one, which is very interesting, and we've seen this where AlphaFold actually was given the Nobel Prize in 2024, where you're now seeing a new model of drug discovery. Researchers had to spend millions of dollars, years of research to understand the protein structures. Now, with AlphaFold, you're democratizing drug discovery. So the digital twins model, which can help and sort of replicate this, is something very potential that we're seeing. So there are these 6 categories of cases. Of course, the first 3 have much more potential in terms of addressing the pain points in the health systems, and the other 3 of enhancing this. So I think that was a great sort of casebook that we looked at and was launched at the Impact AI Summit. And we're hoping to continue that series in other parts of the world as well.
Okay, so those are 6 categories. And of those, would you say I mean, I'm just like trying to glean from what you had suggested, which ones are most far along? Would you say it's the tools for triaging, the example you used in China? And if that's the case, could you just walk us through a little more about what that process looks like, how they're being used, et cetera?
Yeah, so Matt, the first 3, as I mentioned, vision is the most advanced, and we're actually working towards guidelines for that, right? Because computer vision is much more advanced, we get much more accuracy in those, and these are evolving much faster than before. So that's definitely one area which has much more accuracy levels also. The second one, as I mentioned, is the decision support tools. So what we're trying to do is build decision support tools with WHO guidance, clinical guidance into them, working with the strong partners. And that's where I think the triaging services have the potential, because there is a big problem of healthcare providers. I mean, and it's not seen, it's not sexy. The providers don't look at it, but that is there. And if we want to have better healthcare services, that's going to be the problem. And the third one is the predictive models, where we are seeing simple problems: access to hospital systems, access to clinical services, even those, or as I said, predicting postpartum hemorrhage as a simple one, predicting other models of diseases. Those are some of the potential ones that we're seeing.
Okay, well let's flip the conversation around. What technologies so there's a lot of promise, some deployment, lots of challenges and lots of hype. What are the technologies that you see? And this is to both of you. So maybe I'll just stick with Sameer for the moment. We'll move back. What are the technologies that you see that are maybe the most hyped, with the least evidence so far? And on the other side, what are the technologies that you think are actually less recognized and most promising?
Yeah, I think technology, that's a great question, man. And I get criticized for saying this. I think generative AI is still hyped up in terms of the service in the healthcare segment specifically. And the reason being, the models it's using, it's taking a very different turn to how diagnosis is being done by people just going and asking ChatGPTs or Claudes about healthcare services. And they're not necessarily adhering to WHO guidelines, clinical guidance. And that's why the hype comes in, because it's pretty easy to have that, but it's not actually delivering on the promise. And that's one part of the bigger issue in terms of technology. Having said that, the technology is amazing. The other simple technologies are much more powerful and need to be replicated. And that's what we're working with the governments to see. As long these systems are in the health requirements, they are at the frontline requirements. You can, I mean, what often we've seen this is people create solutions and then try to find a problem to fit to it, which is what's happened with the generative model. Is we have fantastic solutions tools there which can do things, and now let's try to find a problem that it can solve. That doesn't actually meet. It goes to the hype side. And the other hype is all this flashy words about clinicians being replaced and medicine be a one central democratized health concept straight up. I mean, these are big hypes to discuss. There's no science behind it of how can clinicians be replaced with when we don't have enough clinicians to sort of service the healthcare provider. So I think having the human in the loop process is critical. And these are not technology problems. These are systemic problems that need to be addressed. And so if we want to succeed on that, I think it's more than technology, it's a systemic approach. And having said that, I think generative AI is, I mean, we've seen a lot of interest from Anthropic, from OpenAI to work with WHO to integrate these guidance to make them verifiable, as we call them, verifiable AI.
Rose, what would you say are the to some degree you're a specialist, but you're also more broadly interested in AI applications across global health. What are the technologies that you see might be overhyped, and which ones are underhyped that we might not be aware of that have more potential?
Thank you very much. And I think Sameer has given a very good account on some of the technologies. And I understand that one critical one that we've seen, especially gaining the hype currently, not just in the healthcare system, but across almost every domain, is the generative AI tools that have been integrated into especially healthcare system, which is one of the key and very sensitive domains. We still have a lot to grapple around, and especially when it comes to the data that is being used to generate whatever responses that generative AI tools are providing. We've seen scenarios, especially where I come from, where people actually these days want to go to a TikToker to provide, support to their healthcare situation. We've seen, especially the youth not wanting to go to clinic to get medical attention because there is a chatbot that they can interact with privately in their different homes. And I think it has had a very big hype, just that we don't yet have how this information that they utilize on all these sorts of platforms and how those are impacting, especially the bigger aim of, improving the well-being of whoever is using some of these tools. I know that in terms of one of the biggest challenges that we still have, especially in the healthcare domain, is the data and how everything revolves around the kind of data that you use and what kinds of regulations are around it. From the WHO perspective, I know there are ethical guidelines and governance structures that have been, frameworks that have been developed. But when it comes, to country level or ministry level implementation of some of these ethical guidelines, we've not yet seen, very big enforcements coming in. And so whoever is using some of these tools without, critical, very tangible limitations on how and what things they need to put into consideration of the information that they consume, especially in a very unregulated environment, is very, very critical. So that's one of the things that I've seen being one of the areas where the hype has been, especially utilizing artificial intelligence in diagnosis. I know that most of the tools that are being developed around diagnosis, if we are not in the testing phase or piloting phase, we've seen some countries doing very quick decisions into deployments of these tools, especially in the healthcare system, to provide routine decisions. And I feel that sometimes some events before the rigorous evaluation of these tools, before the rigorous gaining of evidence of these tools, and to inform the correct way or the most ethical and responsible way of integrating these tools into the healthcare system. So in one part, we are seeing a very big shift, especially having these tools disrupt and inform and improve disease diagnostics, but there is still need for us to get back and step back and say what standards have we, utilized to regulate, to evaluate, to assess, so that at the end of the day, we have kind of a standardization on which these tools are going to be integrated for routine diagnosis and informing the overall confirmation of whatever And that's why mostly at this phase, we want to think about these tools as decision support. But we've seen some scenarios where these tools are already being, elevated as being autonomous, as being very quick, as being very fast, without having us to first step on the pedals to understand and not move beyond the governance of the ethical considerations of this. In my context, again, we still grapple with things like, interoperability between systems. And I'm thinking about, okay, if we want to have a chatbot that is going to inform the Ministry of Health about how data that's received from one district to another gets to, inform a kind of intervention decision. But we still have scenarios where we have disintegrated data systems. And without us having to think about, especially if we want to make these tools reliably supporting the decisions that are going to be taken up, especially at the we need to step back and think about whether if we are to embrace these tools, we are taking care of the underlying requirements for us to see the impact of these tools. So those are some of the areas where I see having a bigger hype into the utilization of AI.
This mention of generative AI reminds me of a conversation I had just last week. I was in Madagascar, and I was talking to someone who has been a leader in health system strengthening among multilateral entities. And I asked her how often AI is being discussed across her ecosystem, right, among math, and she said never. We're not talking about it at all. And I asked, well, how often do you use ChatGPT? She said, every day. Every day I use ChatGPT. And she said it laughing, but it reminds me, you say that generative AI might be the most overhyped, and I think that's consistent with what you're saying, but it also makes you wonder if that might be the easiest entry point where people are naturally using it. So it's like maybe that could be used as a strength. I don't know. Like what you're saying is it's way behind on its reliability, but if that's what people are naturally using, do you think there might be an opportunity to better train generally accessible chatbots that people are going to be using anyways and use that as a reliable resource? Do you see an opportunity there? It looks like you're frozen. And maybe I'll share that with Sameer.
Sure. Just gonna wait for 10 seconds now. Yeah, no, I think there's an opportunity, as I mentioned, Matt. I think the opportunity is to try and use that leverage. I mean, for decision support tools, for other areas, we're seeing that it's just that there's a gap in terms of the way it's functioning right now. And so that's why the verifiable nature of AI, especially in the generative AI model, is very important to make sure at least the first entry point is the WHO guidance, which has been published and created by member states, by experts globally. So it's referring to that, and rather than just jumping around. So there's potential, but there's a process for the potential that needs to be deployed in place. Rose is back, I think.
Hi, Rose. I don't know if you were able to hear that question.
No, I think I dropped off a bit.
Well, it's a question. It was a question about generative AI, which you had mentioned is actually looks like it has the biggest risk, right? Because people are maybe overusing it. It's not reliable. It's not validated, and it's providing health advice. And I was sharing how I had talked to someone at a high level in the health system space in Madagascar last week, and she had said at a personal level, like no, AI is actually not something that that her partners and people she works with is relying on or even talking about much. But at a personal level, she uses ChatGPT every day, which she said laughing. She was thought it was funny. And I was just asking if maybe there's an opportunity there, if that's what people are naturally turning to, if on the one hand, it might not be yet validated. On the other hand, it might be an entry point that I wonder what you think about that.
Yeah, it's actually an entry point, especially in scenarios where you don't have you have a limo of no expert on ground. We've seen it work in so many different ways. But my greatest challenge, and I think while I shared that, was the fact that if these tools are well validated, if they're well evaluated, then we can maximize the impact of some of these tools. Because yes, it comes to provide you the solutions at the comfort of wherever you are without the need to really even think about a healthy facility. And in some scenarios where we actually do lack this expertise on ground, it comes in very, very handy. So there is a very big technological opportunity that it creates for us to have it integrated into the healthcare system. While we think about this impact, can we also think about how responsibly we can be able to utilize it, and how can we maximize the impacts that come out of it? Because yes, it's a very good tool. We are not negating that, but we're thinking about if we are to finally rely on it, what are those standardizations that we need to think about? What are those pedals that we need to step on and get back to ask ourselves, how ethically was this information curated to inform whatever responses a particular patient or a particular person is thinking about? And this goes back to us thinking about the foundations under which some of these tools are being generated. Can we be able to audit the pipelines of data that are feeding these tools, so that we know that, thinking about whatever outcome of ChatGPT, whatever solution that is being informed through a generative AI tool, we are certain and sure that, well, this is the right information that we are receiving. On the other hand, if there could also be checks and balances, and I'm glad that we're having this conversation with the WHO team available on call, because these are some of the critical conversations that we need to think about, that yes, these are very great tools and we need them, especially in scenarios where we have a lack of expertise, where we don't have enough resources to access, some of this information. Can we be able to utilize them? But how are we responsibly utilizing them? How are they being governed? How are they being audited? Who is at the tail end checking whether this information that is being provided through these tools is actually the right information that is getting to a patient? Because at the end of the day, we want to think about what are the healthy outcomes that have come out of this great tool that we are using.
That's actually a great segue. Thanks for saying that. Sameer, Rose just asked a lot of important questions. What is your response to that in terms of, or would you say these ethical guidelines and validation and offering some true guidance on how AI is being deployed and validated and tested and used responsibly are among the most critical questions of the coming years? Is that what's your response?
I mean, one of the questions, right? There's not one, I think, simple question to answer for these things. It has to be a systemic approach, and it has to be localized. I think that's the key. When I'm saying there's no one formula fit all approach for healthcare systems, there are very different requirements for different countries. And so while the technology is central, is the neural system, what we need to do is make sure that it absorbs this ecosystem. So ethics was a key part. WHO, actually working with the experts, launched our first guidance 4 or 5 years ago now. That was the first thing that we worked on, actually helping the National Ethics Institutes to deploy and see how they validate or research in terms of AI and what are the ethical components. There are checklists that have been deployed. So this is part of integrating into the ecosystems or the systems actually directly. But then, as I mentioned earlier on, the governance is the key around it, right? So not just having the technology ready, but then does it fit in the regulations? How agile is the governance mechanism to the deployment? Can we change these rapidly? And that's something which is key, where we're working with the regulators to change their models of regulations, because regulations have to be also agile now as the technology is evolving. You can't just take and say, okay, we can't, it's not like a drug where you regulate a drug and you deploy it in the market all throughout. This is evolving. So how do you regulate those AI systems to be in the system? And that has to be the core of that work. And I said, as I mentioned, the big question to ask is AI working? No, that's not a question. It's working. It's here. We've seen it deploy. Is it working here where you want to deploy it? Is it in your country? That's the main question I think we're seeing in this case.
Okay, great. All right, our time is winding down a little bit, and there's a number of questions from the audience. So why don't we jump into those? And one jumps out as related to this conversation. Here's one question someone had posted: who should ultimately be accountable when an AI-supported clinical decision causes harm? The developer, the deploying institution, the clinician, or the government regulator? Maybe that's a good one for you, Sameer. And Rose, if you have a response, I'd love to hear that too.
Yeah, and there's not one person to be held responsible, but I think it's a shared responsibility. It depends a lot on the legislation system of the country that it comes from. We have regulatory guidance written for countries to adapt to the local settings. There is a legal guidance coming up, which will actually help countries draft laws for the countries on doing this thing. And the core of these is the liability question. Who is liable for what? And it's not, again, as I said, not one person responsible for doing this thing. It has to be distributed, and it will be distributed by countries where governments take ownership, the care provider has to take ownership, the patients have to take ownership, and the developer has to take ownership also of some parts of it. So it cannot just say that I'm doing the solution and take it and then you're responsible for whatever it is. It cannot be that case. It cannot be the case saying that the healthcare provider is that software is coming from that guy. I don't know about it. It has to be that shared responsibility. The levels and the way it's done is based on the risk parameters that each service or which each AI solution can provide.
Mhm. Rose, do you have thoughts on who should be held accountable?
That's a very interesting one, and I think Samia has really highlighted it very well in terms of having a leveled approach to accountability. But we've seen scenarios where the matrices for accountability have not either reached, especially in the different countries, because they are not yet developed guidelines. And I think we need to put in place the matrices that are going to account for that accountability. Because if you tell me that I'm I'm a developer, I developed the tool, I assessed it against the matrices of performance, that is probably the ROC, accuracy, and it was giving me 99%. Sometimes I feel as a developer that, I've really accounted because I've put into considerations all the requirements that require me to have a better performance, in terms of the tool that I'm developing. Until we try to think about that scaled or layered level of accountability and what matrices or thresholds hold for who is accountable and how do we define that. I think Samia has already talked about the checklist, but how granular is that checklist into defining the matrices of accountability? Because at the other tail end, the medic will tell you, okay, I do the oversight, but I don't know exactly what the model is doing. We've seen models that are having a black box, although we are trying to move towards a scenario of explainable artificial intelligence, but still, there is still that complex layer where the experts are not yet, trained to understand whatever the model is doing behind, and they are waiting at the tail end. So if they miss out a mark in whatever the model was doing in the background, and they receive, this good accuracy, and then they rotate around it and then say, okay, this is a better, who should be accountable for that? Because for them, they'll be like, okay, I depended on the tool, and my expertise from what I'm seeing is this at the end, but what the model was doing in the background there, the expert pathologist or microscopist at a given facility may not know that. So as we think about the levels of accountability or who is accountable, we need to also put into guardrails and, be specific onto what is to be considered for accountability. I think that will also be very important.
Yeah, and the answer is going to depend on the specific technology, right, and how it's being used. Okay, another question from the audience. What would success actually look like 5 years from now for AI in global health? Fewer clinician shortages, better outcomes, lower costs, or stronger local capacity? Which metrics matter most?
I think all of them, Matt. I mean, I can start off with saying if we can address the pain points in the health system, but I think what the core part of this is two fundamental things which I keep on reiterating, or three rather. The first is protecting trust, right? I mean, if we can enable trust in AI systems, and this is a big statement I'm making, there's a lot of bells and whistles that go behind it. If we can enable that trust, I think it will be a game changer. So the 5 years timeline I would say is can we actually protect the trust factor in this AI and invest into that? Second is, have we changed the investment patterns of how AI is being integrated with healthcare systems? And that's very critical. And I keep on saying this because ministries, I've seen some very senior people saying AI is free. I mean, we can just deploy it, right? I mean, that's ChatGPT, I can use access. That's not, I mean, that education part is important. And then understanding how you need to reinvest your thoughts into AI is critical. It's the saving of the $500 for cervical cancer screening to a few dollars, but that needs infrastructure investment. The healthcare providers need to be ready for doing that. So that I think is an important part in the whole ecosystem. And the third, very critical, I keep on saying that is we'll fail miserably if we don't focus on the ecosystem and the governance, because we are not ready right now there. And that's the biggest bottleneck I see. So in 5 years, if we want to see ourselves, I think that has to be the main part of change.
When you say governance, are you talking about the regulations of how AI is being used, or are you talking about something else?
I'm talking of ethics, I'm talking of regulations, I'm talking of evaluations, right? So having all those three intertwined together are critical. Ethics in the process, because otherwise, I mean, people talk of illegal AI, people talk of misuse AI, hallucinations, just abusing AI. And that's why ethics is core. And I think that's very important when we talk of national level systems of integration. Second is regulations and agile regulations, not something that will block. And when I say regulations, it's not about being the big brother, it's about facilitating that in the rightful manner. And that's about going back to the trust factors. Is this trustworthy? Can the countries, the people trust the government systems? Can the people trust the developers? Can the countries trust the developers? And that cross combination. So that's the part of governance and the regulation enforcing that trust factor. And third is the evaluation, which feeds into the regulation is how do you evaluate this on a real time basis to make sure that these are working properly or not.
Mm-hmm. Rose, did you want to say anything about how you measure success?
Yeah, I think Sameer has given the checklist, but I want to sandwich that with the practical way that, especially from experience, interacting with healthcare providers. And I think before we went out to interact with the healthcare providers, we had this bigger question: can we be able to develop an AI tool that amazingly detects malaria with a very good accuracy? But I think when we interacted with the different facilities, and that at different levels, from those that are, referrals to the local healthy facility down, the key questions they were looking at are, how can we be able to use this artificial intelligence tool usefully to especially support us in our day-to-day workings? At first, actually, they were like, okay, if I can be able to just do away with straining my eye through looking at through the microscope, I think that's already useful. So thinking about artificial intelligence, especially, and how we integrate it into the healthcare system, is not for us to just think about the bigger question of, are we building this mega complex technology, rather than to answering questions of how are we building the tool to make it useful, to make it sustainable, to make it trustworthy, especially within the real world healthcare system. That has been one of the key considerations that we've seen work out, even in terms of having us interact very well, especially in a field that already had skepticism around introducing digital technologies into their standards in the healthcare systems. The other thing that we've also thought about is that building local evidence is very important to building trust. As we think about how do we build trust, it has been a process of us interacting with the healthcare facilities, engaging them, co-designing these systems with them. So I think what really works out is for us to make the tool part of the communities where we want these solutions to be integrated. And the only way we can do that is sometimes by way of showing, and that is through the evidence that we are generating and that these tools are generating. So what I was trying to say there is that for communities to be able to embrace the tools that we are developing, they have to be, provided with the evidence to show to them that, this tool, this is how it works, this is how it's creating the impact, and we scientifically break down that impact to measures or units that are understandable into their field. For example, if a technician has been taking like over 1 hour to do a diagnosis, can we show them that this tool is able to break that down into the smallest units of time possible. So for them, that is very impactful. For them, that's very useful. And I'm thinking that if we have to think about how AI can be used in healthcare, that is very, very important to create evidence, but evidence that is contextual, especially in areas where these tools are going to be integrated to impact the communities.
Right. I mean, essentially you're saying, is this making people's lives easier? Is it making the health workforce job easier? Can it do it better? And there's lots of different ways to measure that. Okay, let's go to a couple other questions from the audience. This one you sort of answered, but let's just try it again. And see if you, after on reflection, have a single answer. While the potential for AI in global health is vast, what do you believe is the single most impactful quick win we have seen in low resource settings so far? One answer.
Vision. I think vision right now is the most potential.
Rose. Imaging. Sorry.
Experience, because literally we have very, very few experts. So anything that is able to augment their work, that is able to support the very big numbers of patients that they receive. In some scenarios, you don't actually have an expert on ground. It becomes very pivotal to look at tools that are supporting them into the critical parts of healthcare, and that is usually diagnosis.
Mm-hmm. Okay, great. We've got a little more time, so let's do it. So let's talk about non-technical barriers. As has been mentioned already, many AI pilots in general, of any technological innovation, and LMIC succeed in controlled settings, but fail to scale sustainably. We see this all the time. Sameer, you were talking about pilotitis. What have you learned about the non-technical barriers? Procurement, trust, regulation, workflow integration, maintenance, internet access, or training. You all have mentioned all of these in one form or another, but I'm just curious how you respond to that question.
I think one point I want to mention here is, and this is we're trying to change a little bit. A lot of the investments in research go into innovation research or clinical research only at the very limited settings. There is a big gap in investments in implementation research where we talk about scale. And I think that's why we're talking about taking it to a real life setting and expanding it. And that's why I keep on saying this question, whether it works here is not what we addressed. We just talk of whether AI works and then we leave it at that. It needs to be in that setting that we want to do it. And I think if we can't, it goes back to my point about in rethinking investments. NIHs, the research councils, they keep on investing in the similar research, new ideas. But how do you take this to scale? That thinking has to come into the investment space as well, if we are really serious about scaling it up.
Oh, go ahead, Rose.
Yes, exactly. It's more priorities bias usually continues, especially when you have no sustainability models in place. And to get to a level where you have sustainable tools where you can be able to commercialize, and I think that gets back to the levels of commercialization, to the levels of investments that are put into some of the projects that are going to go beyond the lab level to a scale level. Most of the funding that comes in, especially, is just limited. It's only for you to either develop a proof of concept, and after that, because you can't be able to sustain it at that level, you need multiple layers of support to the time when the tool can be actually sustainable to look after itself, to scale it across the different multiple environments. But it always goes back to the financing models, I think, that are usually available to the researchers or to the innovators, that are sometimes they limit to certain levels which are not sustainable. To most of the projects need to kick them off the ground to reach the level where they can be sustainable. And that requires a tremendous amount of investments. It requires a tremendous amount of efforts and resources to go into that process. And I think we need to come back to a conversation. How do we sustainably kickstart off most of the projects or initiatives that have been developed to a certain level? And how do we potentially put them to a phase where they can be able to sustain themselves for us to see a widespread scale of these tools to sustainably and impact the different environments where we want them to reach.
So both of you have talked a lot about the need for investments and a lot of important questions to be resolved and answered. When I talk to frontline implementers, decision makers, they're scared of AI. And the reason why they're scared is exactly this. It's that the level of investment necessary to even resolve the questions of what the ROI is, like to determine what is going to be the path to what are the sustainable technologies that they can be adopted in an environment where the systems are already highly distressed, where like the basics like supply chains aren't being met or HR shortages already exist. It's not that there isn't the potential for hope that this will help resolve, for example, an HR issue. It's that getting to the answer of that, a validated, reliable answer, requires so much effort and energy and resources that it has the potential to put a lot of pressure on systems. So I don't know. Do you have a response to that? Like, how do you manage the pressure? Whose responsibility is to figure this out? And how do we do that in an environment that's already distressed? Many environments that are already distressed.
I mean, again, if it's outside of the ecosystem, outside of the health system, it's going to add burden on the healthcare worker, and that's rightfully the scare, because they're not educated, they're not informed of what this potential is. So, as going back to the basics on the drawing board, where are the pain points for the frontline workers, and how do you address them? That's where we saw ambient AI. That's where we saw some of the ways where actually the vision can help the diagnostics or the triaging of the patients with solving their problems. If you're adding to the burden, and this has happened in the past when we added digitalization in terms of recording, they had to first do the sort of care provision and then start learning a new technology which they're not used to, and then add records into it. It was not intuitive, and that's, I think, where we have to see is how do we make the core of it being the health system provider, the frontline worker at the core of it, and saying how do we help him, and actually without organically do that without sort of burdening him. I think that's the core part of it.
Okay, we're actually out of time. I just realized. Do you have any final thoughts that you would like to share? Any parting bits of wisdom? You have said a lot and have been pretty consistent and clear, I think, about where you think we stand on the promise and the challenges.
Well, Matt,
Rose?
2 points from my side. One is really enjoyed talking to this discussion. I'm hoping the audience enjoyed it. But I do want to say that if we want to achieve the AI work, we need to work together. And so that's what WHO is trying to do, is if you are actually as a researcher or a developer or a country implementer or beneficiary want to do something around it, let's work together and reach out to this platform. And we've worked with Rose a lot, great work that she's doing. So that's an open sort of invitation and a call for everyone to work together so that we can meet the pace of AI. But thank you again, Matt. Really enjoyed the discussion with you.
Thank you, Sameer. Rose, any parting?
Thank you for having me on this very important conversation, especially where we're thinking about how can we harness all the capabilities that come with artificial intelligence to improve healthcare. I'm glad we're having this conversation because it's from these conversations that we shall see impact reaching, the grassroots where we want that impact to be felt. And like Sameer has said, this is not just a voice that should come from Matthew, or a voice that can only come from Rose or Sameer, but it's going to take the developers, the healthcare practitioners, the policy makers, the different stakeholders at every level to get involved for us to see this impact as we still grapple with all the different hindrances that we are still seeing in terms of governance of artificial intelligence in healthcare. If we can also think about how we can take care of the ethical considerations into healthcare, I mean, these are all going to sum up into something that we shall see impacting and revolutionizing healthcare in the long run. Because at the end of the day, what we all need is better health outcomes for improved well-being of our people. Thank you. And
That's a great message. So the final message is, at the end of the day, we're trying to get better healthcare, and no one's off the hook for making this kind of technology, these kinds of developments work. It requires the entire ecosystem. Okay, I think that's it. Thank you both for joining. I hope you weren't drinking coffee. I was. Have a a good afternoon and evening.
Thank you so
Thanks,
much.
everybody.
Thanks, everyone. Bye.